The program Well Body Talk, where they come to you live from the Society for Early Democracy 98.1 FM. Well Body Talk na program where they come to you every Thursday from 5 to 6 o'clock every time. Inside the program Well Body Talk, we dey talk about different sickness, wetin dey cause am, treatment, and self-prevention. As inside the program Well Body Talk, we dey always get experts in the studio for talk about different sickness. And inside this edition of the program Well Body Talk, we studio guest now Dr. Mariama Turay, in a pediatrician at the pediatrics department at the University of Salon Teaching Hospital Complex. As still inside the program Well Body Talk, in there for talk about common childhood illness, toothache and oral hygiene in kids. And where they present the program come to you this Thursday evening. My name na Karifa to Conte. Remember, say yourself where they listen and watch we live on Facebook. You go be part of the program by way you go send a comment or text message to the number 077981981 or self you go now here the Democracy Facebook page. And later on inside the program with the open phone line, outside people will call the number 077981981 077981981 and the number where you go call and be part of the program. As today we dey talk about common childhood illness and toothache and oral hygiene in kids. As we get the expert in the studio with we, well, I want to welcome the studio guest, winner Dr. Mariama Turay. Good evening and welcome to the program Well Body Talk.
Good evening and thank you very much. I'm glad for the answer today.
Okay, the program now Well Body Talk, they come to you live from the Society for Early Democracy 98.1 FM. Dr. Mariama Pijalo, today na the first time. Turay, sorry. Today na the first time for Canada Well Body Talk program. So you go tell me more than Dr. Mariama Turay in the medical field.
Okay, so me na pediatrician. That means me na doctor we specialize for take care of pikin them. I dey work na the Oladuin Children's Hospital, where people can commonly call cottage. And this hospital they under the University of Sierra Leone Teaching Hospital Complex. So I dey offer services, take care of sick pikin them. I also dey lecture medical students them, where they rotate through the pediatric department for let them self learn but pikin business.
So how long you done the practice?
So I done the practice for the past 13 years. Yeah.
So how you can describe the role where you play in the medical field?
So as a pediatrician, as I say, I dey take care of pikin them. We pikin them sick, we go watch them and find out wetin do them. We treat them, we talk to the mama and papa them. Apart from treat sick pikin them, we also dey try for help for prevent sick pan pikin them. We now one of the things that I don't do say today for can radio for can talk and educate the people them, but still the way they affect pikin them and how for handle them. Another way again, me role again at the medical field now for help for train medical doctor the way they come up, so that then self go get the knowledge and the expertise where we need for the all work together for improve pikin business na salon and not to just pikin business, everybody well body business na the country.
Okay, continue for the with me na the program. And name na Dr. Mariama Turay, in a pediatrician na the pediatrics department na the University of Salon Teaching Hospital Complex. As students at the program Well Body Talk, we dey talk about common childhood illness, toothache and oral hygiene. So now look, come to the topic proper from the medical point of view. Wetin na toothache where we can normally call teeth.
Okay, so as it simply mean literally no bed no day. It means say we person teeth the heart. Basically na dandy. So you get different things that we can cause them. So today we can't talk about one of the things that will come up at picking, but where people are not can usually take serious or they can neglect them because they say, oh, na picking, after all you get for change teeth. Forgetting say, how you don't begin take care of that picking teeth from when you're young, it can affect later on whether picking pull that in permanent teeth, we can call as they grow now, that permanent teeth. So we get for start from where they're young. So it's equally important and it is a common problem where we can see pan picking them.
So what are some of the things that we can cause teeth pan picking them?
Okay, so one of the most common things that they cause teeth pan picking them now what we call dental caries or tooth decay. Simply in simple terms, it means say where the teeth they rotting. So one of the things that we can cause this teeth decay now where picking them they eat too much sugar food them and drink too much sugar teen them, and it's very common pan pikin. So according to statistics, about 90% of pikin them now the world do experience this tooth decay. And salon them in do in school picking in salon in 2017 them in do a survey in school picking them at salon. They will then survey 1,174 picking them, and out of them picking them, the 82% of them picking them they don't suffer from this tooth decay, or we can talk say the teeth rotting. So now one of the main thing that we can cause teeth arts pan picking them. Another thing we can cause the teeth for arts now where the gum inside the mouth, you know, so you get the teeth, you get the tongue, you get the gum. Where the gum, you know, say now they hold the teeth inside the mouth. So if that gum they get infection, it swell, it can cause the picking for complaint of teeth art. Or that thing again we can cause teeth art with na trauma. That's if picking for the, you know, picking the way then they play, run, then go for down, they whap their mouth, sometimes then the teeth can broke, begin shake, the art and it can come on. Another thing again we can cause and way picking they eat food and food fasting between their teeth, especially if they eat like maybe something then charm beef or then charm chicken. If this chicken or this piece of this beef fasting at their teeth, you go find out say their teeth then go out. And then another thing again we can make picking in complain like say then get it out. Now we picking in the teeth. That means say when the teeth they come out, they begin come out. So sometimes you go complain say mommy me mouth the arts, me teeth the arts. That means say the teeth one bust come out. So now the most thing common thing now the way can make picking and teeth the arts. But and then one they are all what I don't call the main one now where the teeth rotting, we can call dental caries or tooth decay.
Okay, so now most of them causes then the way you don't mention and one way can normally present to picking but come and can normally take and say and a small picking no they get it out. So what thing normally you can say to them kind come and there.
So I can tell them say not only when it comes to titat, I don't know, most people can feel say because na small picking and they need to feel. Apart from titat, but all that thing they can say, oh na small picking need to feel. Okay, forget say small picking itself na motor man, then get feelings. So anything way they affect big person, they affect picking. So picking themselves can get titat. So I can tell them, so you go for take care of your picking teeth. Not all because now picking means say you no get it. Some picking the way then they feel pain, then go talk. But you get some picking the way then they able to talk. But something then the way then go show, we go give you an idea. I say yes, this picking something I teeth the atom. And as they go on with the program, we will talk about them thing then.
Okay, we get any specific age like where picking goes, you go say picking for see a dentist?
Yes. So the dentist advise say as soon as that picking in first teeth come on, if you can go to dentist, let dentist siam.
Okay.
And as early as 6 months to as late as 1 year, that picking for don't go get in first dental checkup. That means say the teeth doctor for don't go see that picking day.
Okay. So plenty time come and can normally use the paste like me if I get picking maybe the paste way I use now that same paste that they take for give me picking for brush in teeth. So waiting again you go advise towards standing or which kind paste for make command and for they make them picking and they use.
Well, you can use the toothpaste way big person they use, but the thing is you use that in small quantity. You know go pack like how you pack that big person in your own toothpaste because you got to be careful back. Dentist and they advise say the toothpaste way good for use now the toothpaste way get fluoride pan because fluoride good for clean the teeth and it protect the teeth as well. So as long as the toothpaste get fluoride, you can use them, but you know go use that same amount where they put pan picking toothbrush. Pan big person toothbrush for the picking. You could just put a smear depending on the age of the picking. Because if you put boku, tendency they say some picking and then go swell around. And then sometimes the back then can sell them picking toothpaste them. So you can watch out for that back na the market or na the supermarkets if you're able to afford them.
Which kind toothbrush picking for use?
So picking them for use soft toothbrush. You get a small toothbrush them back. So not use hard toothbrush because if you use hard toothbrush, the teeth get something where we call enamel, when at the outer covering where they protect the teeth. Just like how you get your skin, you can that way they protect you. Now the same way say the teeth get something where they protect her. So if you use hard toothbrush for them, you go destroy that protective layer they within the teeth. So now I make the advice say for you soft toothbrush.
Okay, continue for the with me now the program. A name now Dr. Mariama Turay in a pediatrician at the pediatrics department at the University of Salon Teaching Hospital Complex. As today in the also for talk about common childhood illness to take an oral hygiene in kids. The program now well body talk they come to a live from the Society for Radio Democracy 98.1 FM. Yourself can be part of the program by way you send a comment or text message to the number 077-981-981, or self you go now Radio Democracy Facebook page. And later on inside the program, we go open phone line. Also, people go call the number 077-981-981, 077-981-981 are the number for call and be part of the program. As today we talk about common childhood illness to take and oral hygiene in kids. So Dr. Mariama, as we done the talk on the different causes of to take and safe. So now let's look out how parents then for effectively teach them pick them how for brush and teeth.
Okay. So how for brush and teeth. The first way for us to say use the soft toothbrush and toothpaste. For small young picking, then just maybe you just rub the toothpaste na the brush, and then if another one teeth you the brush the one teeth inside, you brush and outside. Okay, the one the way get boku teeth, make sure so you brush every part of the teeth. And you do them in a gentle manner. In as much as you try for clean the picking teeth, you know want for cause harm to the picking and wound the mouth as well. So you brush them in a circular manner every side. All the jaw there, you go na the jaw, you go to the other jaw, the left jaw, the right jaw, you brush them before. You brush up the one the way they up, you brush the one the way they down, and also brush the inside of the teeth them. Because if in that side they safe, bacteria can get at the bacteria and then the way they call it afafafaf tumbo there, where we need to see with we eye, and where if you no brush them, pull them come on at the mouth, then go form something we call plaque when a cow, and then anytime we eat food.
Okay.
The bacteria they work on that food they. We work on the food, they broke and they form acid. That acid they not good for the teeth. So now make and they destroy the protective layer of the teeth. So now make what they say for brush every corner of the picking in mouth. And apart from the teeth, some people can just focus on the teeth, forget to say no to the teeth no more than at the mouth. The tongue safe than at the mouth. In as much as you clean the teeth, you also clean the picking in tongue as well.
Okay, so some how picking a wakey sock finger can normally affect them teeth, and how it can affect them teeth.
So picking away the sock finger, you know, say then still they develop.
Okay.
The teeth not form, it's fine. So one of the things that we can do, like because when they sock them finger, where the teeth they go, now make sometimes they can see some picking and get cack teeth because of the. So they change the way how the teeth for form instead of it form straight, whichever way depending on how they sucker, they see the teeth the cack can before. So now one of the things and picking away in sock teeth because we can suck them finger because you know picking and they play and sometimes then go forget and no go wash their then put their inside their mouth and they introduce the afafafaf tumbo they will call jamster from the environment, put another their mouth, now then teeth all that they contribute for let the teeth get decay and rotting.
Okay, so you mentioned say that they affect for make picking and get cack teeth. What about the one that we can get double teeth? We think it be the problem with that.
Okay, so double teeth, what can cause double teeth? As I said, picking and get, well, almost man, you get two sets of teeth then. You get what we call the primary teeth, and then you get the permanent teeth. The primary teeth, now in the picking, they grow up with. Wait 6 months, they begin see that teeth they come on, and they add until they picking 3 years. And then they go be 20 teeth. Then after that, when they begin reach 6 years now, they begin change teeth. Most picking them.
Okay.
But some man can do it early as 5 years. Some man can change it as early as 7 years. But most picking them as 6 years. Then they begin change these teeth. So sometimes if enough space not there, then sometimes they're not complete for change these teeth. Then the permanent teeth self can come more, can add to that primary teeth there. Now you can make the picking and can get double teeth.
Okay. So what are some of the risk factors the way parents them for always they look for them picking them way in terms of where they talk about teeth?
Risk factor like for waiting in terms of the toothache.
Yes.
Waiting they cause the toothache.
Yes.
As I say, one of the most common thing the way they cause toothache now for eat boku sugar food, and then drink them sugar drink them. Okay, that is now one of the main factor. So they get for reduce out for this sugar when they eat. As another thing again, what we call poor oral hygiene means say, what's in our oral hygiene? Oral hygiene just means say the state and the way how they take care of remote, all the within our remote, the teeth, the tongue, the gum them. So basically na that and how that they get for affects the function of the mouth. That is, we know so they use the mouth for eat, the mouth now they use for talk. Even when they use the mouth, the mouth even they help we out for blow. So it simply mean how they take care of them oral hygiene the mouth.
Okay.
So one, as I say, you get for the reduce the sugar the way then they eat. Two, you get for the brush mouth regularly. The dentist they recommend say for brush teeth at least 2 times for day.
Okay.
Excuse me. Which means say 1 time for day not enough. Okay. Because just imagine you wake in the morning, you brush your teeth in the morning, fine. You don't go about your business. You go all day, you go do eat, the picking go do eat cham, biscuit, sweet. Now net back where come, you go lay do sleep. Where you go sleep, the germs then they be all that eats way don't left in mouth. The germs then they build up on her and then they act on her and then they increase the risk for form decay. So now make na net before you begin sleep, you for also brush in teeth and clean your mouth. Then now. The main thing. Another thing again we can see back young baby especially young baby the way they use feed the bottle. Mama and something that the mama then can left the feed the bottle na their mouth. We then they drink the milk or drink the pap we get boku sugar. So if they left that feed the bottle, they begin sleep. They left feed the bottle na mouth. They increase the risk for me then get the teeth rotting and then get toothache. So it's okay advice not left feed the bottle na pikin in mouth. If the pikin don't eat, don't clean in mouth and make it sleep. If you pass and sleep where they feed, pull the feed the bottle na mouth. Not left let the milk they go inside the mouth. So now the thing and now they will can advise say mama and papa for do. And also we can discourage also for especially if big people then get that big person they himself get tooth decay. You get some people they way then go like for tooth picking begin kiss the picking.
Okay.
And one of the things the way they cause the tooth for decay na bacteria. Sometimes you don't know sometimes that person the way they go kiss the picking, you get tooth decay in teeth store rotting.
Okay.
Bacteria they then mouth. You go kiss that picking there. Obviously through the pit, you can transfer that bacteria then mouth to the picking teeth. Inself go get am. So now make we advise mama, papa, if you know say you teeth rotting, you get tooth decay, make sure say you take care of how you handle them because risk say you picking them go likely self get that same thing there.
Okay, so I think it cause bone teeth for pikin.
So basically bone teeth na like where the teeth rotting back. You get tooth decay. So as I say, where the teeth you get mostly 3 layers them on the teeth. You get that protective layer we call the enamel. You get one way the inside when at the dentin. Then you get the other one inside we get the nerve where the teeth can do what's in. If you see the charm, you go touch down the nine can make the teeth can act. So if you don't get this teeth decay, that line in the within at the teeth, it don't go become the tumbu and the germs then don't go destroy that line, the teeth where they protect the teeth. It don't pull them away. It cause tooth decay and the picking can get bone teeth. And again, how then they come about? One of the main thing there na the boku sugar and where they need to brush the picking their mouth or clean the picking their mouth fine.
Okay, continue for day with me na the program. In name na Dr. Mariama Turay, in a pediatrician at the pediatrics department at the University of Salon Teaching Hospital Complex. As in also today for talk about common childhood illness to take and oral hygiene in kids. The program now will body talk. They come to live from the Society for Radio Democracy 98.1 FM. Remember, say yourself where they listen and watch you live on Facebook. You will be part of the program by writing send a comment or text message to the number 077981981 or self you go now where the Democracy Facebook page. Then later on inside the program we go open phone line. Also people go call the number 077981981 077981981. So Dr. Turay, normally we can see also picking them, then turn them kin white. What think it cause dandy?
So one of the things that we can cause now again, if you not clean the picking tongue fine.
Okay.
It go white. Food we don't eat all the food. Don't the food they just they form layer and layer. So one of the things for prevent that the back now for clean the tongue. So it depends on the age of the picking. Usually you can begin clean your picking mouth as early as where the picking young baby where you born them. Because you know say they suck bobby and milk we can form layer and the picky in mouth. So one of the most common thing there now where the food don't dey na the tongue. So what you can advise say young baby you can use either towel, special towel, soft towel. You use lukewarm water for clean them. So you can take that towel you wash your hand fine with soap and water. You take the towel wrap around your finger and take am in a circular motion, clean the pikin mouth, the tongue, and all around the mouth. Another thing again we can make pikin dem tongue white can cause and even not to the tongue no more, up the mouth, even at the inside wall of the mouth. And now which we call oral thrush. Then there are some infection we then call fungal infection. Then the back now the half to move we know see which we have.
Okay.
But the difference between, say, some people can mix confused and they whether na milk, then na the pikin mouth or na for oral thrush. The difference between them, the milk is easy for clean out. When you put how you clean out, they come on. Okay. But the oral thrush, you know they able to clean them with the method what I don't talk about so. So when you notice and if you pick in for go na hospital, let doctor see and then go mark medicine for clear than.
Again, I ask wetin dey cause smell mouth for pikin.
So one of the things that they cause smell mouth for pikin them na tooth decay or dental caries or where the teeth door rotting. Now one of the main things that they cause the pikin them mouth for smell.
Okay. Another
thing they cause the pikin them mouth for smell now where the gum, if the gum gets infected, it don't get infection, it swell, sometimes they go see the gum, they bleed, it can cause pikin them back forget smell mouth. Another thing again, if they not clean the pikin mouth, okay, as I say, where food go na the mouth, you get the afafafaf tumbu then where we can call bacteria where they na the mouth, where they go act pan them food there so, and it can make the food rotten. So if they not clean that pikin teeth for pull that food particularly na the pikin mouth, it can result for lady pikin get smell mouth. So now the most common thing and they like it get for do but thing the way they na the mouth. You get all that thing there advanced thing they like advanced sick the way can cause people the way not to the mouth forget smell mouth. But now the main thing and now you hear pan pikin. Okay.
So we get anything like when they say this they born out with smell mouth, get possibly they born with smell mouth?
Me no, I don't think say any pikin or the way then they born with smell mouth. It depends on how you clean the pikin mouth. Some people don't believe that, but I think say if you practice good oral hygiene, as to say from that day one way the pikin born, as soon as that pikin begin eat, it would advise say and the dentist and the advice say if you begin clean the pikin in mouth.
Okay. The program now will body talk they come to live from the Society for Ready Democracy 98.1 FM. Remember say yourself for the listen and watch you live on Facebook. You will be part of the program by way go send a comment or text message to the number 077981981 or self you go now Ready Democracy Facebook page. And now na time for make we take break inside the program.
Condition is permanent. Oh yeah.
No condition.
The condition is permanent. Oh yeah.
No condition.
The condition is permanent. Oh yeah.
No condition.
The condition is permanent. Oh yeah.
Like we are living my bedroom. It's full of so much surprises. You may be up and feel no one like you. In my bedroom, no one knows tomorrow. Never look down on anyone. Let's be there for one another. 'Cause today is me, tomorrow might be you. 'Cause no condition.
The condition is permanent. Oh yeah.
'Cause no condition.
The condition is permanent. Oh yeah.
'Cause no condition.
The condition is permanent. Oh yeah.
'Cause no condition.
The condition is permanent. Oh yeah.
This is Chapin's music.
Laughing at someone's situation, not knowing we are all God's creation. But one thing I want them to know, yeah. No condition is permanent. You never know if someday you will find yourself in that same situation in this life. You've seen today, tomorrow
condition is permanent. Oh yeah.
Cause no condition.
No condition is permanent. Oh yeah.
Cause no condition.
No condition is permanent. Oh yeah.
Cause no condition.
No condition is permanent. Oh yeah.
Shout out to you, white priest. YUK man of the moment. I salute you.
The program now, well, Body Talk, they come to you live from the Society for Radio Democracy 98.1 FM. And where they bring you this edition of the program, well, Body Talk, my name is Kaifa to Conte. Well, inside the program, we go now with the go outside with reporter Elizabeth Matuma. I been talk to different people in our free turn for no but waiting they understand but the common childhood illness and to take and waiting can cause titat papikidem and safe oral hygiene. Well, then talk more to the reporter Elizabeth Matumansaye.
Mostly na cold. Because like na cold mostly can affect some pikin before ever sit inside because like cold is common. So even with the big one then. Sometimes big person like the pikin where you don't know say can get cold, it go attack one thing for malaria because cold and malaria like na they also dey waka. Like it hardly to me for last pikin will get titat. Although it can dey sometimes, but like ain't not easy. For like you go say titat dey make pikin admit. Sometimes it can be, but like it's not common. So me own idea, mostly na cold. Whereas like maybe some man can say due to sweet or for take care of the mouth, some man sometimes they scrub the mouth. They can say na pikin. Now not use brush or waiting, but like pikin brush then they can still use that. And the times of food they back where they can eat. Do this, some man they go buy beef. You get the pikin later one for eat. Sometimes that beef they fasten at the teeth, and you know they scrub the pikin mouth. So automatically that it just go for get bacterial or it gets infected. You just go for scrub the pikin mouth. You observe your mouth because like some Saturday and they just all are normal. They play with her, you go they wrestle with her, check her. Like me, I can wrestle with me because even in ace, I can only ace. If you see for like just number for examiner in ace, in nose, sometimes they open your mouth for watch her.
Parambele, vomiting, toilet, and then no more. If I will take care of her, probably mouth, so all tea for what they eat. Like this meal now, colic is the fast.
Well, pneumonia na number one. When you get more of pneumonia, you can carry with cold, sometimes in infection, sometimes in the unfeed the pikin them. So water they go outside, water not for go. So you can get pneumonia, and more can begin them come to me. Well, it affects them bad because sometimes when they come, they know they talk the truth. They know they give for toxin. Our water we don't give them all. The water don't go outside enough for go make we don't canaya. So pass we get for me behind them. They ask them many questions with some investigations. Then the way they picking the breathe can make we don't say now water they don't give them they don't get pneumonia. So sometimes we self can do the best for no for make them well and recover. But sometimes they can late. So can lost the picking them. Well, one of the precautions for take we then can we always tell them, and I'm not saying in every hospital they give them that teaching they get belly. They're not for they do hand feeding. Hand feeding now one of the causes to make the picking and then they aspirate the food, whether na pap or water, we're gonna make people have their lungs, we're gonna make them get difficult breathing and they for breathe. So me on focus on this all na education, how they for feed the picking them.
Well, that's not some people in our free talk. We talk to reporter Elizabeth Matumansaye outside and we talk about the common illness them pikin and safe to waiting they cause titat and safe oral hygiene pikin them. Well, Dr. Turay, you don't hear it, so some of them comrade and the way we reporter talk to about waiting I don't understand it, but then so waiting I response towards that.
Okay, I'm glad for the comrade respond and waiting the response, sorry. And wait till then see. The only thing no more, like as I talk, people are not can take titat business serious man pikin. They start first come and say, na pikin titat, no say titat so come up pikin. Titat come up pikin. So even before I can this program, I talked to the program manager, Dr. David Kamara, when I na the head of the oral health program na Connaught Hospital. And he tell me, I say how often I can they see teeth pan picking, they say, but we say something out of 10 picking they go see. 5 of them picking and they come with teeth. So it is common. And sometimes some picking they no go able to talk say they get teeth. Right, but what you for watch for how you go see sometimes you go see this speaking it torment they cry don't do all thing for do and then they respond. Or sometimes you go see the rub in jaw or sometimes what you go see the picking sometimes in jaw swell. You go know say this speaking sometimes and it's the atom. Okay, so picking then they get it at and it is common and it all boils down to waiting that comba say. You know they clean your picking teeth, you go get and beef as I say, you do fast in 9 months, you know go clean your mouth. So for more prevention, they will need for the clean the picking their mouth. And I'm glad the back way comba they are aware of the common secret way they affect picking them. The rumbele, the cold, the vomit, the diarrhea. So it good. I'm glad they say the combra they are aware. And I'm glad for that person we talk about the hand feeding. Because now one of the things the way they affect to picking them seriously way. Now common practice people can say where the picking and they eat for knack and we say so knack and don't for feeder. And at that knack you go knack the picking don't force and for eat. Where you see the eat as one person say the eat go sign up for go. Then I decide way for blue. And by the time they can count something they don't too late. So I'm glad the way then talk about that and or they advise mama, papa them, do ya then granny them. May they need knock them picking them down for force for feed them. If they picking not well, you know go able for it. Same way like big pussy, where you know well, you know they get appetite. We're picking themselves sick, they need to get appetite. But you get for patience for feeding small. Thank you.
Okay. So it's not some of the signs and symptoms that we come for the look for them picking, especially the one that we not sabi it for talk, say then get too tight.
Okay, like I say, the picking go they cry boku, it go torment. Sometimes it go they rub in face or they rub in mouth, like outside the rub now one thing and they another thing again sometimes the jaw go swell. Or another thing you notice sometimes you go say me picking in mouth they smell fine. Sometimes you notice say out they pull bad odor in mouth they smell. Then one of the sign that we go, especially for picking the we not able for talk. It's the one that we go talk, then go tell you say, Mama, me teach the arts. Where are the charm? Me teach the arts. So now some of the things and sometimes the way picking and can teach where they teach one boss, they can also get teach arts. So especially for the young one, how you can know say this speaking teach the arts. Sometimes then young one there, we know 1 year is then baby them. When then they pull teeth, you go notice say sometimes then they put their hand inside their mouth, or then go they take anything where they see then they pick and then put their hand for rub then gum for suit themselves. So now some of the ways then land.
Okay. The program now well body talk it comes to life from the Society for Radio Democracy 98.1 FM. Remember, say yourself where they listen and watch real life now Facebook, you go be part of the program by way go send a comment or text message to the number 077921981 or self you go now Radio Democracy Facebook page. Well, inside the program now with the open phone line, people go call the number 077921981 077921981 and the number for call and ask question about the topic who they do it then at the program winner Titats and oral hygiene per picking them. The number for call and be part of the program now 077921981 077921981 and the number for call and be part of the program. So Dr. Turay, what are the effects of Titats and poor oral hygiene per picking them?
So as I say the poor oral hygiene, the picking go get tooth decay, and tooth go rotten. Then when it rottens, not only the teeth, the gum self will become infected and it go affect the picking. So now where the picking teeth the arts and gum don't become affected, waiting they happen, this picking are able for it. And picking it for it, then they grow, they need for get a well balanced diet and need for the eat. So one, if this picking teeth the arts, you not take care of picking moths, it go refuse for it, and where it refuse for it, you know they for it, you know go grow like I for grow, you know go get the nutrients there, the thing the way need for learn body grow. So now one of the effects and then another thing again, where picking and they grow, as then they grow then they develop their speech. But if they get problem with their teeth, it go affect their speech and it will affect the development of their mouth. Inside their mouth. Another thing again, the effects of picking them. We'll say picking. Some people can say picking and they shame. Picking and they shame. If that picking they get tooth decay in mouth they smell. It go same in company go provoke. I know picking away then at school. Especially them picking away get bald teeth. not to one or two times something that I don't meet speaking and like the mama go carry the pikin at clinic. I go say how this pikin vex so the pikin they smile. Then the mama go they provoke the pikin say doctor now because I get born sits now making a degree for smile. You go face na something we not see us, but they affect the pikin because of him born sits that pikin no go get confidence for smile, and if you must the smile no go get confidence for talk na public. So it affects them self-esteem, it affects them confidence. And then as something we you know go see now, but it affects how then they socialize, how then they carry themselves in a society. Another thing where pikin get it at, you know they get they affect in school one. Wetin go happen if that pikin sits there, you no go able go na school. Even if the mama say no, pastor you go na school, you no go able concentrate because one you go dey in pain. So it go affect the pikin in school one, and it affects the pikin in overall health. So no, not just look at